name's Nancy Hill. I'm a nurse practitioner student at Auburn University, and today I'm going to cover lipase inhibitors. Lipase inhibitors includes Xenocol and Ally. Xenocol is a prescription medication that costs about $650 for a month's supply. Ally is an over-the-counter medication that costs about $50 for a month's supply. Lipase inhibitors inhibit the absorption of fat by the intestines. They inhibit the pancreatic enzyme lipase, which is responsible for fat absorption. The fat is excreted in the stools undigested. Lipase inhibitors are absorbed in the GI tract. There's minimal systemic absorption. They are metabolized by the enzyme CYP450. They're excreted mostly in the feces. Precautions that need to be considered when prescribing or recommending a lipase inhibitor include kidney stones, anorexia, bulimia, organ transplant patients, and you should weigh the risk and benefits if your patient's lactating, because there's no human studies with patients taking lipase inhibitors and lactating. Contraindications include pregnancy, chronic malabsorption syndromes, and cholestasis. Common side effects are mostly GI in nature. About 50% of patients that take lipase inhibitors will experience a GI side effect. These include oily spotting, fatty stools, diarrhea, nausea, abdominal pain, rectal pain, and back pain. Drug interactions to look at when taking lipase inhibitors. You should avoid giving a lipase inhibitor to a patient that takes cyclosporin and warfarin. Caution should be advised if the patient is taking amiodarone, metformin, anti-epileptics, and thyroid medications. Many drugs require special monitoring, so really review the whole list of drug interactions before recommending a lipase inhibitor. Lipase inhibitors are meant for patients that are obese. They are to aid in weight loss for patients that have been unable to lose weight with exercise and dieting alone. It is appropriate for patients that are 18 years of age and older who have a BMI greater than 30. As far as the rational drug selection, Xenocol is more expensive than Ally and is a prescription. Ally is affordable and available over the counter. Patient education for patients taking lipase inhibitors should include that the medication should be taken with meals or within 1 hour of eating a meal. It should be taken with meals that contain about 15 grams of fat. If the meal is fat-free, or if the patient does not eat a meal, that dose of medication should be skipped. The patient should be eating 3 well-balanced meals a day that are low in calories. The patient should be drinking plenty of water. The patient should be taking a multivitamin at bedtime. And exercise is always important to any weight loss regimen. And in closing, take 1 Ally with each meal that contains about 15 grams of fat. Ally should be taken with 15 grams of fat, not 50. And also, Landon, sorry, no Ally for you. Ally is for patients that are over the age of 18 and have a BMI greater than 30.